Welcome to the Cheer Athlete. On this week's episode, we're going to talk about what it means for if your cheerleader is knock-kneed and pigeon-toed. And at the end, I'm going to give you 5 exercises to help work on improving this. So make sure you stay to the end because they will be there for you as we go along. Welcome to the Cheer Athlete Podcast, where we bring coaches, parents, and athletes expert tips and advice to help keep cheerleaders healthy, strong, and at the top of their game. Now let's go. All right, let's talk about being knock-kneed and pigeon-toed. I think in order for you to fix a problem, you need to know what the problem is and why it's occurring. And this involves doing a movement screen and figuring out exactly what's going on. Now, what does actually knock-kneed and pigeon-toed mean? Knock-kneed is when the knees kind of come together and the toes turn in. This can happen for a number of reasons. If it's happening all the time and your athlete is kind of walking around with the knees more turned in and the toes turned in, there's likely there could be some malalignment at the hips that is just how they were born. It doesn't necessarily mean that you have to do something to fix that, but they may have a different shape of their pelvis and their hip might be a little bit more internally rotated. I see this a lot in kids who maybe are lower tone when they're born, and low tone is kind of a little bit more floppy and not necessarily they're we might call them double jointed. You might call them a little bit more loose. They're the kids that maybe W sit when they're babies. Again, it doesn't mean something's like terribly wrong. It just is something to be aware of and checking to see, if you are a little bit more internally rotated and your knees go in, your toes go in, what does it feel like for the toes to go out and the knees to go out? And one thing I like to check is sitting crisscross. Can they sit crisscross on the ground and do the knees actually rest on the ground? If not, they might have a limitation there. And there's a lot of other things that we do in clinic to look and see, is there something structurally going on? You could, chances are you're not just going to go and say, doctor, I'm knock-kneed, give me an x-ray, because they're not going to do it. If you're having pain, they might go and do an x-ray. But that's a way to tell and see. An x-ray will tell you if you have a structural change in your pelvis that is causing the hip, from where the hip meets the pelvis, to more internally rotate. That just means it's harder to get a turnout position and you don't want to force that. So jumps might not be as turned out as we like, but it doesn't mean they can't be pretty. It doesn't mean you can't learn to at least go a little bit into external rotation and get the power and the lift from them. It's just something to be aware of. I like to look at, in the clinic, we do a movement screen. And if I'm coming to you to do a team assessment, I'm going to do the functional movement screen. We look at a squat pattern with the arms overhead. We look at an inline lunge, which is standing with one foot in front of the other, going down onto one knee and coming back up. And the things we're going to look at for both this, so on the squat, I'm going to look, do the knees cave in? Can they do the squat? Can they actually go butt to feet? And if they can't do it with their feet on the ground, can they do it with their heels elevated on, about an inch? And see, that they make an improvement with that. If they have pain, I'm going to refer out to me as a physical therapist. If you are looking at this as a coach and they're having pain with any of these movement patterns, refer out to have them get seen by a physician or a physical therapist so that they can evaluate and see, like, do they need something else and what else is going on? So we're looking at a squat, and then we're looking at the inline lunge where we go down onto one knee and stand back up, and minimal sway, and looking at, can the heel come up in the back foot and can it go back down to flat? And where are the knee positions in this? And can they maintain a vertical, like a perpendicular to your shin position on your trunk, from your trunk to your shin? Then we're going to look at a hurdle step. And a hurdle step is where you set up a string about just below shin height, like just below where your kneecaps are. And that's called the tibial tuberosity. So you set it up there. So they stand with their feet together and hold a stick behind their head In one motion, they step over, tap their heel, lift it back up, and come back over. And here we're looking, does the pelvis stay level? Does their hip drop out to the side? Do they have to really course correct with their trunk? Those three things in particular are super important for if someone potentially presents with knock-kneed. And that will give me a lot of information on, do they have the motor control in their hips and their core to be able to do these basic movements that all cheerleaders need to do. The FMS, the other ones that we look at, shoulder mobility, a straight leg raise, active straight leg raise where you're lifting your leg up, a trunk stability push-up, can they push up off the ground? That could feed into the pelvic control. If you don't have good solid control in your core, you might wobble in that trunk stability push-up, and that could feed into the control in your hips and your knees, because everything is connected, right? And then rotary stability, where it's like a bird dog that you put opposite arm and leg out and come back in, touch your elbow to your knee, go back out and come down, and maintaining a nice level pelvis. Now, this is another great one to look and see, where is that limitation? Because if they had a limitation in the hurdles and in that inline lunge, and they come down into this rotary stability, and they can't maintain a level back, then we know we're going to look at the core and we're going to look at the back to make sure that that's stable first, so that the hips can move and hold the legs steady. So that's a basic movement screen. And I think that's really important. It's stuff that you can do. I've got a video, I've got a program that you can kind of talk yourself through. I go through some of those exercises and some other basic movements that I would do in a physical therapy clinic, not just in a personal training clinic. And so from there, we find out what's missing. What do we need to add back in? And maybe where are they hypermobile? Where are they undermobile? Most of the time when these kids, they are limited with the stability on the inline lunge, the squat, obviously, because that's a very complex pattern. But going down into one knee, standing on one leg like a lib, and moving the leg, and the balance and that rotary stability. And that looks at maintaining the hip control and making sure that things are all lined up. It could also be an ankle problem. So I might look at on one knee, can your knee go over your toes and stay in line, or is it really drifting in? And is that a mobility at the ankle, or is that a hip stability? Those are different things that I will look at in the clinic, and it gets complicated, to put it all together. It's very easy to do, but like putting those pieces together will give you that information, like, yes, they need to stretch their ankle and stabilize their hips, or they just need the stability in their hips to be able to correct where their feet are, which is, I'm going to say that's about 90% of people, at least in kids. Adults, their feet get pretty stiff. Cheerleaders and gymnasts, we're jumping or landing. They could have some stiff ankles too, but they're usually driven because their hips need some more stability. Again, if you're having pain, you want to refer out to a physical therapist or a PT, and have them assess what's going on and correct that pain. There's no need to have pain with any of these basic movement patterns. And it's very easy. It doesn't mean you have to stop doing physical therapy. It just means you have to learn some exercises and maybe have some hands-on work to be able to correct that. Things a physician, a medical doctor might look at would be what is the alignment of their kneecap to their hip, and like look at the Q angle. And again, that might involve an X-ray. That could tell you if you have like a patellofemoral syndrome. So if there's likely could lead to patella tracking issues, where the inside of the knee gets weak and the outside of the leg gets more tight, and so you need to balance that, and that drives the knee in. Having somebody that's chronically, the risk with somebody that's chronically knock-kneed and pigeon-toed is that they are more likely to, they have a higher risk of an ACL injury and a potential for more ankle sprains, just because of mechanics. So it's really super important to get into a strength training routine so that this doesn't happen. Now, just because they have this position change when they squat or when they do that, if they're not having pain and they can do it, and what I'm more concerned on when somebody's coming in and their knees are going in is, are their knees coming in and kind of wobbling like this? If they're just coming in a little bit, and then they're able to control that, and it's not really wobbling, and they're not losing that stability in the knee, I'm not so much going to worry about it if it doesn't hurt. And if it does hurt, do it different. Turn your feet out, change the angle just a little bit. That potentially can help to really kind of retrain and allow the pain to go away. So again, go get checked out because the physical therapist will give you some different cues for how to correct that as you're going. But if they're stable and they're not wobbling as they're moving, it may or may not be an issue. I always think it's good to do preemptive strength work and kind of retrain the muscles. But it all depends on where your athlete is at, and they may or may not need to do that. Strength training is always good. So I'm going to say they do need to do that, right? They do need to do work to get their whole body moving and, get their hips strong, get their ankles strong, get their core strong, and really learn body positioning so that they can do the higher level things that we're asking them to do. But the worry about it is, don't worry about it is what I'm saying. Do the work so that you can prevent things like an ACL injury or a ankle sprain. And that if you do have symptoms of patellofemoral syndrome, so things like, going downstairs, it hurts and kind of pain on the inner part of the knee. Maybe you hear a lot of cracking and clicking and grinding. That's very common when we have patellofemoral symptoms. And it's not something that necessarily stops you from doing anything. There's no real limitations other than what it feels like for you. So I've made myself some notes and that's what I'm looking at. By the way, if you are about to get into talking about the exercises, so if you're watching this or you're listening to this on iTunes or on Spotify, so if you're listening on iTunes, go check out the YouTube video at my handle is the cheerpt.movebetter, and all the exercises, you can see this video live on YouTube, and I'm also going to post just the exercises so you don't have to sit and listen to this whole thing again to go find them. So those will both be there. If you're listening on Spotify, click over because there's a video that goes with it as well. And if you're on YouTube, go check out my other videos. There's lots of hip exercises in there to help build stability as well. And please, if this helps you or it helps you think there's somebody in your cheer world that would benefit, please share it with them so that the information gets out there. Please hit that subscribe button and let's build this to make more people aware of how to prevent injuries in cheerleading. Thank you so much. There's my plug for the day. So we've talked about the risk of the knock knees, and we've talked about, not so much in the way that they move, but can they do it with good control? So let's dive a little bit into the exercises. So I got 5 exercises that we're going to talk about today. And I am going to, as we go along, you'll have some videos here that will show you how to do them as well. So the first one is the Turkish Get-Up is a whole exercise, and it basically starts from lying down and ends in standing and then goes back down into lying down. Now the first piece of that Turkish Get-Up is a roll to elbow, and that's what I'm going to show here. When you the roll to the elbow, you are working on hip external rotation on the leg that's bent up. And we're just going to roll up onto the elbow, keeping our chest proud, our ribs down, but the chest proud, and our arm up by the ear. You're going to keep your eyes up to your hand. And we want to make sure that that foot is grounded solid into the ground. And we're pushing our knee towards the wall away from the leg that's up. That will create that stability in through the hip. And that's similar to doing a bridge, but it's just working on the hip external rotation with extension. And then you're going to roll back down. Now you can do this for reps. You could, I like to use this as a warm-up and kind of retraining, but I also use it as a strength exercise, and it's a great core exercise because you're getting a lot of oblique work as you're rolling up onto your elbow. So that's the roll to elbow, the first part of the Turkish Get-Up. Next exercise is it's kind of a combination. We're going to do crawling and we're going to do hip circles. So on all fours is the position. And the first place to start crawling is down on your knees. You're going to just crawl forward 5 times on each side with control. What I like to do is put a ball on your back or a foam roller or even a book, something to make sure that that doesn't go sliding off your back. That tells us that your hips are staying parallel and that your core is stable. From there, you're going to lift your knees up off the floor and do that same thing. 5 crawls forward, 5 crawls backwards. If you're that more advanced, 5 crawls sideways and 5 crawls to the other side. Then you come back down. Now I'm counting this as 1 exercise, but it's really 2. In quadruped, which is all fours, like the crawling position. This is a very important position, and a lot of kids that come to see me who have more valgus at their knees, which is that knock-kneed position where their toes turn in. They were lower tone at birth, and they may have been a little bit more not developmentally challenged, but sometimes they skip crawling. And this is one of those really important exercises because and developmental positions because it builds a lot of core stability while moving our extremities, which is exactly what needs to happen when we walk. So it's a great exercise to reintroduce, and it's a lot harder than you think. But one position that one other exercise on hands and knees that I like is a hip circle. And why do I like this? Because 1, your athlete's going to feel like they get some flexibility with it. 2, they really have to maintain that 3-point contact, the 2 hands and the 1 leg, and keep a level back as they raise their leg up, circle it out to the side, and bring it around. And you can do this in each direction. Usually just have people do 3 to 5 of them just to try to groove the joint. The up and out is what is missing and usually what needs to get strengthened with somebody who's knock-kneed. And we want to make sure we maintain a level pelvis. So again, as you're starting, because it's super frustrating when you can't hold that block on your back, just, really go slow and try to start to feel that, you're not tipping. When that's super easy, put a ball on your back and make sure it doesn't fall off. I don't think I can do that anymore. So that's exercise number 2, so crawling and hip circles on hands and knees. Our third exercise is a half kneeling rotation. So for this exercise, you're going to be on 1 knee. You're going to raise your opposite leg out to the side so that 1 knee is up and 1 knee is down. Now your up foot should be directly in line with your knee. Your toes are pointing away. And we're just going to work on holding here. I want those ribs down. I want your pelvis level. I want your chin slightly tucked, shoulders relaxed out of your ears, and you're going to have your hands down. We're going to go into a low touchdown. That's the easiest to balance it there. Now, where is your knee? Your knee should be in line with your hip. So if your knee is starting to cave in, put a little pressure to push your knee away from the center, push it towards the back wall. This will create some work into the outer part of the hip. That'll also create some stability in through the foot. Obviously, whatever we do on one side, we're going to repeat to the other side. You might find that one side is easier than the other. Start by just working on holding here in center. Once you can hold that for 30 seconds, maintaining your posture cues, you can make it a little harder by rotating towards the down leg. And we're going to just go slowly at first. We kind of just half pivot towards their down leg and come back. And then we're going to go farther, bringing your hands in that low touchdown out to the seam of your pants. Try to work on holding that position while you're maintaining your hip at the up hip, pushing back towards the other wall. This creates stability in the down hip as well as the up hip. And it will create that differential motor control that's needed to help control the knees as you're jumping and landing. So that's a half kneeling rotation. And I love that exercise. It's really great. You can end up adding weight to it. Something that, you could press a weight overhead. So maybe for a young kid, you don't need to add any weight. As you start to get, it's easy. grab a lightweight and hold it sideways, or grab a medicine ball, or I love kettlebells. I think a kettlebell is a great tool to use, and it's really easy to include in this exercise. Next, we have a windmill. This is another portion of that Turkish get-up that I talked about for our first exercise. This is kind of the middle step in the Turkish get-up. And for this, you're going to be, again, on that one knee. If you're noticing, we're going from lying down to on all fours, up onto one knee. So we're working those developmental positions to help get you stronger, just as you did from a baby moving forward and getting up into walking. We're gradually getting there. So this windmill is going to work the hip stability as well as a lot of core. You're going to start down. I'm going to have my right knee down to start, my left knee up. My left arm is up by my ear. My left hand is going to slide down the seam of my pants down to the ground so that I'm forming a triangle or straight line from my up hand to my down hand. And I have a nice triangle on my legs and everything's at a right angle. You're going to pause there for a second and then come back up into that half kneeling position. And we're going to do this 5 times with my right knee down, making sure that we keep the posture cues as we come up, that chin's slightly tucked, the ribs are down, the pelvis is level, and we're going down, working on keeping that knee in the right position. So now we're moving our body while we're training our knee to be more externally rotated, that turned out, and maintaining that balance through that leg. We're going to switch legs and do it to the other side. Now you might notice that one side's easier than the other. They might both be the same. They might both be challenging, but generally I find one side's a little easier than the other. None of this should hurt. If it does hurt, back off. You might not be ready for that position. Maybe you need to do some other exercises to get there. If you can go down and up 5 times solid, maintaining your cues, then you could add some weight to it should you choose. This is a great exercise just at body weight. You don't really need to add weight to really work the control and the mobility there. So that's the windmill, and a half kneeling windmill, the middle portion of that Turkish get-up. Standing windmill is another great exercise, but I'm not including that in this video. From there, we're going to look at a single leg squat. And as we're starting to single leg squat, we want to make sure we have that control. Now, a single leg squat is really important for cheerleaders to be able to do because it identifies, like, is that knee really wobbling? Can you do that with control? How is your hip stability? So it's a super important exercise, but it's really challenging and difficult. And I encourage you to use the other 4 exercises first before you jump into doing the single leg squat. I'd rather actually see you do some split squats first, but I want to make sure we get you up into standing and, you're working in standing and doing, some balance work as well. So, and you'll feel a lot of work in your ankle as you get up to do this. As we're starting, work it to a chair or a bench. I'm going to demonstrate it to a bench. I'm going to start sitting down. Going to kick one leg out straight, raise your hands out straight in front of you, and come stand up. And then nice and slowly, you're going to sit back down. Now, the goal is to keep that front leg off the floor. But if you're wobbling all over the place and your knee's going all over, just use your foot as a kickstand. Have it in front of you, have the heel down, light pressure on it, and it'll help to maintain that balance, to build some of that strength as you go up and down. It's harder going from sitting into standing than it is from standing to sitting, but it works your muscles harder going from standing to sitting. So if you're struggling with this, start in sitting. You will come up with 2 feet, slide the leg forward, slide one leg forward, and then slowly sit down with control. As that gets easier, you can again go ahead and try going from sit to stand with just one leg. That's a really hard exercise to do, and I think it's really important that we build up to it and we work on it. It's perfectly fine if you have to do assist as you're starting, because that's going to get you stronger. So down the road, it's easier. If once you progress from that bench, a great goal is to work on a pistol squat where you don't need the bench. You could use a TRX where you're going to assist yourself to get down low. You could and then you can kind of gradually reduce the height of the bench. So working to a low box, and then eventually not needing anything, being able to pistol all the way down where you get your butt to your feet, and then you're able to come back up. I don't have the ability to demonstrate that without assistance, and I can't do that with the equipment that I have. But it's a great exercise, and if you want more, I can talk you through that. And I do have equipment at the gym, so if you want a video about that shows you how to use a TRX and how you can progress that pistol from a single leg squat down to a pistol squat back up, just drop a comment below or reach out and send me an email, and I will do a video on that pistol squat for you using a TRX. All right, so those are our 5 exercises to help with knock-knee. There's plenty more. In the clinic, if you're really struggling, you might also do sidestepping with a band or hip external rotations in standing. I see people compensate a lot with these, and so I like sidestepping, but I like them as dynamic warm-up. I think it does help to get those hips engaged. And I do like the external rotations, but the compensations I see, people end up either not putting full effort in and not taking a full step, or their feet are turning in, their feet are turning out, and then the form just gets sloppy. And they can be advanced, they for people that need to start off on the ground. So if you really are struggling, like start on the ground, make those get-up positions, the roll to elbow, the windmill, the half kneeling balance, the hip circles, and the crawling. Make those solid. That's going to work your hips. It's going to work your control, and over time, it's going to carry over. When you think about it, a squat pattern is actually, if we go down into a deep squat and then lean forward, that's a crawl pattern. So in order to be able to squat, we need to have good crawling and good hip positioning in the crawl position, that all fours position. We want a good squat. We need to train squats, the single leg squat specifically, because that's going to isolate one leg at a time. But we need to train squats because that's what happens when you land out of a jump, or you land coming down out of a stunt if you're popping down, or you're setting up under, if you're base and you're setting up. You need to get into that squat pattern. We need to have that control as we do that. And cueing, to training and cueing can make a big difference, but really getting and having that postural stability, getting those hips strong, and knowing where the 3 points of contact are on your feet, which we didn't really talk about. I've talked about that before. Can make a big difference in helping your cheerleaders to have less knock-knee and not clunk their knees together so they get bruising on the inside of their knees. They want to land with their feet about shoulder distance. Their feet are going to come together, but their knees are going to not be apart. Knees should be touching, but if you don't have that good control, then they're going to hit. So work on landing with the feet hip distance, and train there. And in the meantime, work on strengthening your hips and your core so that it carries over and the landings just get easier. As I mentioned before, I will be having another separate video with all these exercises, so you don't have to listen to this again. If you want to listen to it again, go for it. I hope this was helpful. If it was, please leave me a review. If there's other topics that you'd like covered that fit along this, let me know that too, because that helps me to plan and helps me to give you something that is worthwhile to you. And if you know somebody that needs to hear these exercises and needs these, please share it out and hit subscribe so that you don't miss another episode and that you can keep finding this information easily. I do have strength and conditioning programs for cheerleaders that are up. I have my book is going to be linked down below, and I have a special offer. If you buy it directly from me, then you get a whole mess of other bonuses, which includes workouts, which will help strengthening the hips so that you have less strain on your knees and you can reduce that risk of injury as well. So check that out. That link is down in the show notes. And if you have questions about anything, feel free to either email me, laura@movebetterllc.com, or you can reach me on Instagram. Just send me a direct message, and I'm happy to answer any questions about any of these exercises. So make sure you hit subscribe, go and follow me, and learn more about how to reduce injuries and prevent those knees from hitting when we're landing stunts so that your kids can stay comfortable and not have pain. Next week, I'm going to talk about when when it's okay for your kids to start strength training and can they go to the gym. So make sure you hit the subscribe button so that you don't miss that episode. That's coming up next week. I hope you have a great week ahead. Don't forget, when in doubt, breathe out. Take life one step at a time. You can do anything that you put your mind to, and you are responsible for your own vibes. So go get the day.